You go to the hospital to get better, but do you know the dangers posed by healthcare facilities themselves?
Right now, Target 8 is checking up on a potentially deadly issue it first exposed more than a decade ago: hospital-acquired infections.
Target 8 investigator Henry Erb circled back to find out what our hospitals are doing to lower your chance of getting even sicker while in their care.
I developed pancreatitis. We went to the emergency room.
Deborah Gallup was in a hospital around Christmas 2008. A few weeks after she got home,
Later, I developed these huge, like, boils on my buttocks. I had no clue what it was.
her doctor said it was a superbug, MRSA, staph bacteria that have become resistant to many antibiotics.
It's going to always be with me. And it's very, very frustrating. Some days I feel like a leper.
Gallup says MRSA has affected her work and her personal life, forcing her to stay away from her sister, who has a compromised immune system because of a bone marrow transplant.
That's what makes me the maddest. If I could change that, I would. She's very special to me, and, you know, one of these days she's going to need me, and I can't be there for her.
MRSA is one of the infections that patients can get while they are in a hospital. According to the government Center for Disease Control, 99,000 people die every year from infections they get in the hospital. That's 3 times the number of people who die in car crashes. 1 in every 20 patients gets some sort of infection while they're in the hospital. Deb Gallup believes that's where she got her case of MRSA. But a letter she got from Metro Health said that that particular strain of MRSA hadn't been found in the hospital, and there is no way to determine if that's where she got it. Hospitals say it is difficult to sort out where a patient picks up an infection before they got to the hospital, while they were there, after they left. It's one of the reasons that hospitals go to great lengths to keep their infection rates a secret.
Just because you have numbers doesn't mean that they can be meaningfully compared because of differences in risk factors for patients that come into us.
In arguing for continued secrecy, hospitals say it would take public education for consumers to understand what infection rates mean, how much infection is preventable, how much is not. Grand Valley Health Plan CEO Ron Palmer says there is a valid fear of misunderstanding, but he still favors public disclosure.
So I think that possibly we've kept people in a bit of a Pollyanna state around the fact that there are risks associated with all types of medical care.
In the last few years, some states have forced hospitals to do some public reporting of infection numbers. Michigan is not one of them. In 2009, State Representative Leslie Alice introduced a public reporting bill in the Michigan legislature, but it promptly died in committee. She has not returned our calls or emails inquiring about it. State and federal governments have been collecting some information from hospitals about infections, but instead of sharing that info with the taxpayers, they have to sign a confidentiality agreement to get it. Despite the statistical silence about healthcare-acquired infections, some things have changed in the last few years.
I think there's much more of a focus now on hospital-acquired infections. I think we finally gotten to the place that we recognize this is a significant problem.
One Grand Rapids area hospital, Metro Health, has turned to technology with a device nicknamed the Germinator. It sterilizes rooms of patients with infections using ultraviolet as a backup to the usual cleaning.
I think it's something that alleviates any chance that there's human error involved in the cleaning process.
Just getting healthcare professionals to wash their hands between patients has been a major effort. Some hospitals have made it their first order of business in infection prevention.
And over the last few years, we've made great strides in actually changing that number, which oftentimes in many institutions is 40 to 50% to well over 95% here at Spectrum Health.
Like hand washing, much of the focus has been on behavior, specific steps medical caregivers can take to reduce infection. Many Michigan hospitals joined the Keystone Project, which focused on intensive care units and infections caused by using catheters, lines that are inserted to deliver or take away fluids. They reduced infections 66% by using a checklist to guide safe practices. In 2008, the biggest healthcare payer, Medicare, stopped covering the extra costs associated with catheter and surgical site infections, along with some other preventable healthcare-acquired conditions.
So that there's an economic incentive that I think redoubles our interest as a healthcare system in doing that.
And Medicare's Hospital Compare website even reports some catheter infection information, along with a couple of process measures, how frequently the right antibiotic is given at the right time to prevent infection.
What we speak to, yes, publicly is the processes and how well we're being successful in those processes.
The critics argue that it is difficult for patients to know exactly what those successes mean if they don't know exactly how many people get healthcare-related infections in each hospital. And those numbers remain a secret. I'm targeted investigator Henry Erb.